because some of the reporters apparently weren't ready to go like right off the bat. So they were like assigned someone to a 10:30 press conference and they were like, oh, I can't get there.
Oh, that's dumb.
Yeah.
I mean, at least be ready.
Oh my God, yeah. I mean, there's some days honestly, this morning I hadn't showered. So like, but yeah, if they needed me to be somewhere at 10 o'clock, I would have thrown on a shirt and gone down there.
And nobody would be the wiser.
No, wouldn't have known any difference. So, in fact, I probably look better when I'm all with the shirt.
The natural.
Yeah, exactly. Au natural. Well, I hope they. Did you do the quarantine yesterday?
I don't know.
I saw somebody did. Creed.
There's lunch back for the eat. 16. Anything when I
Absolutely. I think part of that's. Sorry.
Henry and check.
Oh boy. Hello, hello.
Hey, hey.
How y'all doing?
Well, good afternoon, everyone. I want to welcome everyone to our March 15th, 2022 city briefing. Now, as any of you who do business with the city know, we have for many years had a very cumbersome and sometimes confusing email address, richmondgov.com. Well, I'm pleased to announce that through the efforts of the Department of Information and Technology, led by my good friend, Director Charles Todd, people emailing the city of Richmond may now use rva.gov. Let me repeat that. If you email the city now, you can email us at rva.gov. Our city email is now the same as our website domain, which is rva.gov, and this should make it easier for folks to contact us moving forward. Of course, you will still be able to use richmondgov.com for correspondence with the city if you wish. It's not going anywhere anytime soon, so if you still want to use that, go right ahead. We'll forward your email along. And we want to change your bookmarks to address the books to communicate as well. But rva.gov is quite simpler. It's easier, and in my hopes it enhances our communication with our residents and all those who want to correspond with us through email. So, once again, thank you to the Department of Information and Technology, its director, Charles Todd, and for all those out there, please use, moving forward, rva.gov. All right? Now I'd like to turn my attention to the issue that has unfortunately dominated our lives here in the city and the world for the course of the last 2 years. And that issue is COVID-19 and the COVID-19 pandemic. In fact, COVID is the reason why we actually started these weekly briefings some 2 years ago now. And I'd like to take the opportunity to thank all of those who've been involved in the process of keeping us safe and getting through this, surviving, I would say. We're now, I think, as we look to the future, we're in a place where we can start thinking about how we thrive as a community, and we're going to hear a little bit about that in this briefing. I'd also like to take this opportunity to thank all of you for helping us spread the word and the important health information we had to share during these weekly briefings as well. I think it's made a difference. There are a number of people for over the course of the last few years who said that maybe when I could not get a clear idea what we needed to do in my home or as I was going back to work, we tuned into these briefings to get that good information. I'd also like to acknowledge the resilience and fortitude of our residents as well. I want to recognize our business owners, our city staff, all those who persevered through it all. And while we are not clearly out of this pandemic, I do think we've gotten to the point that where hopefully we can live with COVID-19 more than die from COVID-19. The cost has been steep. As you know, roughly 44,000 cases, positive cases of COVID-19 have occurred in Richmond, and we've had over 400 deaths here in the city. And as have we done in times past, I ask that we all take a moment of silence in remembrance of those we've lost over the course of the last 2 years. Over 400 lives lost and 44,000 people who have tested positive. Thank you. Now, that moment of silence right there should serve as a reminder that we need to continue to do things we've been doing to keep everyone safe. That means vaccinations, that means testing, and also following common sense health guidance based in science and also our CDC guidelines as well. We will be holding a dedication later this spring to mark the solemn milestone, and like we did last year with the planting of 2 trees at Powhatan Community Center. But this week, I'd like to invite you to look up at City Hall during the evenings. You all may have heard, as of starting yesterday, we have lit City Hall in red in remembrance of those lives lost to COVID-19. We did that last year, and we're doing it again this year in remembrance. And finally, I can't think of any group more critical to keeping us safe over the last 2 years than the dedicated health professionals over at the Department of Health and also the Richmond City Health District as well. We all owe them our debt of gratitude, which is why today we've invited our good friends, the Acting Director of RCHD, Dr. Melissa Verre, and also RCHD Nurse Manager, Amy Popovich, to join us to provide a recap over the last 2 years and some guidance on what we can expect moving forward. So with that, I believe Amy is going to come up first and provide an update. Amy?
Good afternoon, Richmond. I'm Amy Popovich, Nurse Manager of the Richmond Henrico Health District. It's an honor to get to be here today to spend a moment, reflect, pause on the last 2 years, where we've been, and then in a minute, Dr. Melissa Verre will talk about where we're going. As we think about where we've been, just so that you all know, yesterday we had 8 new cases on our dashboard. That compares to over 1,600 in one day during our highest peak. So we had a moment of celebration yesterday with just those 8 cases. Our percent positivity for here in the city is 5%, a number we love to see. And it was March 14th, 2020, where Richmond Henrico Health Districts first initiated our emergency response. We started by building out our call center, starting our containment process, and working on our big first drive-through testing event. In these last 2 years, our community has been through unimaginable things. Lockdowns, job loss, illnesses of friends, death of family members, and the reality that our communities of color have been hardest hit here in this pandemic because of the decades of disinvestment and inequity. However, Richmonders have been resilient. The beautiful piece of everyone standing up and saying, how can I help and how can I support? And so many folks not staying at home and doing the essential jobs, and healthcare professionals working and giving their all during this time. As we've reflected as a health district of our accomplishments and how we've really pulled together over the last 2 years, we've done over 240 testing events, tested over 21,000 folks across a variety of places here in Richmond. In conjunction with our locality partners, we vaccinated over 290,000 individuals. As of this week, Richmond is 62.7% of everyone has gotten their first dose. We've made it through several vaccine rollout phases. Where we stand today is everyone 5 and over is eligible. We have over 15 months of data now that demonstrate the vaccine is safe and effective. If you want to get yours today or you need your booster, vax.rchd.com or 804-205-3501. We've partnered with the Richmond Ambulance Authority to do over 500 in-home vaccinations to folks who are homebound. And we've worked closely with Richmond Public Schools. We've done 72 events in Richmond Public Schools and vaccinated over 10,000 individuals at those events. I'll also do a brief overview of our testing and our events over the last 2 years. In spring and summer 2020, we started some of the state's first walk-up testing events here in our local communities in Richmond. And then we transitioned to those mass testing events, where in winter 2020 at the Diamond, we did an event where we tested 500 people in one day. Fall 2021, winter 2022, due to the increasing demand with Delta and then Omicron, we've had our community testing events at the Raceway and started distributing those at-home test kits. 2 years later, now that Omicron is receding, we really are focusing on ensuring that our community and our partners get those at-home test kits. You can still get those free COVID tests online as well. And then again, visit our website, rchd.com, for more information on where to get those testing events. A thank you to our partners. We have a myriad of over 300 different places we've been of where we've tested in our community. We could not have done it alone. So thank you to Diversity Richmond, to the Neighborhood Resource Center, to our rec centers, to churches, faith-based organizations that have hosted us while we could do these testing events. For our vaccinations, in winter 2021, it was December 22nd where we received that first shipment of Moderna vaccine, this priceless possession. And we held our first event at Arthur Ashe on December 30th, 2021. We held mass vaccination events at Arthur Ashe and Richmond Raceway in the spring of 2021. And then we transitioned to our mobile events and our community hubs in the summer and fall of 2021. Then we transitioned to clinic and school-based events in the fall and winter of 2021. And here we are, spring, also in the resurgence of Omicron, to where we're integrating our vaccination and our testing events into our regular health department activities, ensuring that our work can be sustained and can follow any ebbs and flows that happen with any potential surges, but that we're really focusing on the goal that every Richmonder that wants to get vaccinated has the access and the ability to get that vaccine. Key partners in our vaccination events have included Virginia Union University, Hope Pharmacy, Sacred Heart, Healing Place. So many of you all have come together and offered your space and your resources and your time. Also, a thanks to our Medical Reserve Corps and the over 4,000 volunteers that have come together at all of our events. The hard work of our public health team, which at its peak was about 350 folks, about a third or even almost a half bigger than our normal working group. Thank you to the outreach teams who went on the ground, knocked on doors, visited people, shared the information of where to get tested and where to get vaccinated. And then community partners, a big thank you to the City of Richmond and the endless support that we've gotten here. Richmond Public Schools and all of our community partners. I want to end this time of where we've been with a quote from Arthur Ashe, the place of whom we've spent so much time. He said, "True heroism is remarkably sober, very undramatic. It is not the urge to surpass all others at whatever cost, but the urge to serve others at whatever the cost." And we have done that, Richmond. Thank you. I'm going to pass it on to Dr. Bray.
Move this a little bit. All right, just for shorter folks. Hi, I'm here to talk a little bit about where are we going to go from here. I think a lot of folks have been asking the question, so are we endemic? Are we pandemic? What does this mean? Where are we going from here? And I would say, in my opinion, we're not at the endemic phase yet. We're not there yet. But we are getting closer to a less disruptive phase of this pandemic. I think, like Amy said, in the health district, we're looking to integrate our services to our response activities, vaccination and testing and other things, within our pre-COVID work, and looking to use these partnerships and these things that we've actually gained from the pandemic and applying it to the non-COVID work that we've always needed to do, and that have really these just health disparities that have become so much more evident during the COVID pandemic. We need to continue to work on those with some of these partnerships that we've gained through the pandemic. We are, as she mentioned, still staying prepared for the potential, whatever's coming down the pipeline. We're still staying prepared for what that may bring. We're in a very different place now. This virus that's circulating isn't the same virus, and more importantly, we have vaccine. We have treatments. We are in a far stronger place now than we ever were in 2020 and in 2021. And we know there's a lot more to learn, but we know a lot more than we did back then. That doesn't mean that we're done. And I know folks are tired of the pandemic, but it doesn't mean we're done. It does mean, though, that there's going to be challenging stretches. There's going to be more variants. There's going to be more outbreaks. But we have tools now that we didn't have before. And I think that helps us to figure out how to ride these waves that are coming down the pipeline for it to be less disruptive and be as safe as we can and still be with our families and our friends and ride the waves going forward. So one of those tools, maybe many of you probably noticed a couple of weeks ago, CDC came out with these revised metrics for community levels. We've come to understand that it's not enough anymore to just look at case numbers. You have to look at the burden on healthcare. You have to look at severity of illness. And these new metrics take these into account. There are 3 levels, and these help us to better understand when we need to take different mitigation, whether or not it's maybe we need to take a step back and have more mitigation practices. Maybe we can be a little more back to our usual state of affairs. There are 3 levels: low, medium, and high. That's green, yellow, and orange. And right now, that metric for us is in low. So what does low mean? That means that we can make mask wearing optional. We can spend more time in person at work. We can spend more time in person with our friends and our families and our loved ones. And we can go out in public and be less, not unconcerned, but maybe less afraid of the pandemic going forward. It's still okay to wear a mask. There is nothing wrong with wearing a mask. The individuals can certainly choose to continue wearing a mask, and there is absolutely nothing wrong with that. There are private businesses that may still want you to wear that mask, and that's okay as well. That is their option. And it's also important to stay up to date. All of this depends on us staying up to date with COVID vaccine. We may see additional, we haven't seen anything recently, but we may see additional recommendations come regarding COVID vaccinations. And if so, we'll make sure to make that, to share that with you all and make vaccine available. But it's going to be very important that we stay up to date on vaccinations. And as well, if you do get sick, if you do have symptoms, you were exposed, don't forget about those guidelines that we've had all the way through. You still need to think about getting tested. You still need to talk to your provider potentially about getting treatment. And on that note, there is one more thing coming down the pipeline, the federal government's program Test to Treat, or Test and Treat. It's coming out in the Test to Treat initiatives coming out in the next, it's been launched, and we are anticipating seeing it roll out here in Virginia in the next coming weeks. More to come on that, but the plan is that you will, through whether it be the urgent cares that you see within the pharmacies, you can go in, like the Kroger's, the Minute Clinics, you can go in, be evaluated and get a test there, and the provider there can then provide you with treatment for if you are positive for COVID, thus enabling more access for more individuals to prevent severe disease and prevent those severe outcomes that we're looking to avoid. And with all of these tools, the key for this pandemic moving forward is going to be staying aware, keeping an eye on what's coming down the pipeline, and understanding your risk level at any given time, using that CDC metric to say, all right, this is what we're looking at now, and these are the mitigation measures we have to take now to keep our families safe and to keep ourselves safe and to keep our community functional during this pandemic. And always, always, always stay up to date, get tested if you have symptoms. Stay home if you're sick. Don't forget these lessons that we've learned over this last 2 years. And as long as we stay up to date and we keep those things in mind, we'll be equipped to ride these waves and be able to spend time with our families and friends and get back to the lives that we've been missing for so long. That's all I have. Thank you, Mayor.
Thank you, Dr. Veray. Thank you, Amy Popovich. Thank you to RCHD as well. Ladies and gentlemen, this is obviously not anyone here spiking the ball. This is just telling you, updating you on the tremendous work I think this city collectively has done over the course of the last 2 years. And as the mayor of this city, I will say, I could have never predicted that I would be governing in a time where there was a pandemic, where folks had to be isolated, there were quarantines, there were shutdowns. Never, ever thought that that would be my time, that would occur during my time as mayor. But it has occurred. We have weathered the storm. We have remained vigilant. We are resilient. And that's thanks to the community that Richmond is. We know about the generosity and the compassion that is found in this community, and it came out so well during the pandemic. The generosity of others, that capacity that we have here in Richmond, it's shown through all of this. And so I'm grateful. As a person who's been affected twice by COVID-19, folks, it's real. It's real. And unfortunately, we've lost lives because of it. Now, as Dr. Verre stated and Amy stated as well, we know so much more. We know so much more now. And we have the tools to combat this virus. And so we will remain vigilant. If you do need more vaccinations, they're available to you. Stay updated. We are here to help. And I think we've done exactly that during the course of this pandemic. HELP, we've helped. So with that, we'll take some questions.
My question is just about moving forward with COVID. I know on Sunday the CEO of Pfizer was talking about a fourth dose possible, also talking about scientists working on kind of an all-encompassing vaccine that might be used once a year instead of us having to get these boosters. I guess from the public health standpoint, I mean, how promising is all of that, and do you think we'll be on this kind of almost like flu-like kind of routine where we get a shot once a year and all that kind of stuff?
You sum up that question for us?
That would be me. Question was, thank you for that, Henry. What are we thinking about all the vaccination options coming down the pipeline is maybe the best way to say it. I would say I find it promising that we continue to look and understand the immunology behind this virus as it continues to evolve and to mutate. I think the jury is still out, and what's going to end up happening is what we did from the get-go, which is that we will, the pharmaceutical companies will definitely, they're going to look and they're going to research and they're going to do trials. They're going to look at the FDA is going to have to evaluate, and it really will come down to what does the science tell us over time, and what is the best available option at the given time. And it may, as we've learned, it may change. There was a time when we thought 2 doses of Pfizer was going to be all right, or 2 doses of an mRNA vaccine was going to be okay. Now we know it's 2 and a booster, or 3 if you're immunocompromised. It may change. We will. I am actually very encouraged that we're not saying, all right, we're done. I am very encouraged, and I hope that we continue to push the boundaries to see what can we do. I don't know if it's going to end up being a once-a-year thing, if it's going to be more than once a year. There are still some scientists who say, well, maybe we can, maybe if we're just doing severe disease, maybe we don't need to go there. So there's a lot of differing scientific opinion, and that's how we, as scientists learn, is we challenge each other and we look at what the best data are to support our hypotheses.
And then just quickly, on the new subvariant that maybe is happening in New York City right now, I mean, on the level of how alert should we be or not, as we're talking about a new normal and less and less restrictions, I mean, what are your thoughts on that? And
You mean not the BA2, but the Deltacron, or the other one?
It's the subvariant of the Omicron, I think.
Oh, the BA2?
Around New York City.
Well, it is in New York City, but it's also, I think, oh, sorry about that. Henry was asking about the subvariant in New York City. I may be not following the right. There is a subvariant that is very prevalent, that's very prevalent in the UK right now. It's prevalent all over Asia. It's the BA2 subvariant, which is the stealth variant they've been talking about. But I don't think it's all that novel. We've been seeing that since for a little while now. It's not increasing with the speed and the rapidity with which the initial Omicron did. We'll have to see what that means for us here, because we did just have that Omicron go through. We have to see also, keep a really close eye on what's going on in Asia and in Europe, because as we see infections, that's where we generate new variants. And so it's going to be that same thing where we just have to keep an eye out, and that metric, by the way, is what we're going to need to do to keep an eye out as we see these new options, opportunities, variants coming down the pipeline. The key thing is going to be keeping an eye on what's it doing on our cases, our hospitalizations, and our healthcare status. And that lets us take that step back to change our mitigation strategies to be a little more aggressive about our mitigation strategies to keep ahead of that a little bit better this time around.
Jamie, while you're up there, so, you know, obviously we talk about the new community spread levels and that sort of thing with the CDC, what you were just referencing. How important is it going to be, given what we've seen from the public throughout this entire pandemic, for people to stay up to date on that, and how concerned are you that they won't?
I think I am just as tired of COVID as anybody else. So I absolutely understand that people are wanting to be done with this. What I'm hoping to see is that these new metrics give us a way to coexist or to thrive despite the pandemic or through this pandemic. So in a way that you don't have to go into lockdown, put your masks on and not see anybody for 6 months. We're hoping that these provide a stepwise tool for us to live with the pandemic going forward, because we have vaccine, we have treatments, we have other options, and not be as drastically impacted this time around. I really do hope that that is a more manageable step for folks to take, but I do have a lot of empathy for folks just being really tired of it. I really hope they do take this to heart to say, keep an eye on it. You know, we'll still be telling you when things change. We'll still be up here telling you when things change. But we're hoping that this is a less disruptive way to go forward, despite whatever's coming down the pipeline. You know.
Mr. Mayor, is there any thought that the city might have any kind of alert system? I don't know, like maybe a dashboard that would tell people how things are going in the city. Has there been any conversation? I mean, maybe that's what you guys would have one. I'm sorry.
The question is whether or not the city would have a dashboard to keep us up to date on where we are, and I believe RCHC has a dashboard. At least DOH does, I know, right?
DOH does, and we put up dashboards. We have a weekly, we do post, VDH has dashboards, a number of them that allow you to look at the level of Richmond City to see how we're doing. We do, since we're not looking to duplicate where it's elsewhere, we do, for the community levels, you can go down to the level of Richmond City, but we just send you to CDC because why duplicate it? What we also have in the Richmond City webpage is we actually have a weekly report that is specific to Richmond City, where we go into a little more depth in terms of what's going on locally, in addition to what's available in the dashboard and at CDC.
Thank you. That makes a lot of sense.
And I know that if you go to CDC as well, they have you can go down to the local level and you can embed that on your website. So that might be something we may look at for our rva.gov website.
Since you're up there, Mr. Mayor, I'd love to shift gears just a hair, if you don't mind.
Sure.
Last night, you proposed the Citizen Review Board framework for the city of Richmond. Can you talk to me just a little bit about what you see as the benefits of that framework and the kind of work it took to get to that point?
Well, the question was about the CRB, the Civilian Review Board. The city introduced an ordinance. I introduced an ordinance last night. And hopefully the city council will take it up very soon, and my thoughts on how we got there. Well, you know, my belief always has been that we can appreciate the work that our police department does, but we can also hold police officers accountable as well, particularly when it comes to misconduct. And I think there's nothing wrong with our community having some oversight on what our department does. And I think this ordinance that I introduced finds the happy medium, I think, where we can essentially set up a civilian review board that fits Richmond. And, you know, I appreciate the work of the task force, the work of the city council, the work of our community as well. I think what we proposed, which was advised and informed by the work of Dr. Will Pelfrey out of ECU, is something that fits Richmond. Richmond is unique, and I think Richmond should have a civilian review board that fits our needs at this time. And I think that's what our proposal does.
You know, the police department recruiting, make officers want to go elsewhere already. What kind of consideration was given to that idea when forming this proposal?
The question was what was, there are some officers or people who may say that this could lead to more attrition and people leaving and more staff shortages. And did we give that any thought when creating this? The only thought that we gave to this civilian review board work is which model fits Richmond, right? We knew already that we needed to support our police department through better salaries. We know they need a better workplace as well, and that's exactly what we're tackling. That's why my budget features an increase, a new pay plan for police and firefighters. And I think we have to do on one hand, we have to support our police department, but also we have to also focus on accountability as well. So you get that from this administration. Our support of our police department through more funding, salary increases, but also through accountability as well, something that our community wants to see too.
So just to be clear, that was kind of a separate thought.
Separate thought. We were hearing from officers about how do we stay competitive in the region when it comes to salary. We've done that. Now the starting salary is $54,000 in my proposal. That keeps us $51,000 in our proposal, from $44,000 to $51,000. That keeps us competitive and allows us to be tied for the pay leader in the region. That's what I think is going to keep police officers here. At the end of the day, Chief Smith has worked in a department that has a civilian review board, and it's worked quite well in a lot of cities across this country.
Henry, you have a question? Good?
All good?
Can I do a quick addition to
Sure.
what people can do to respond? Great. Hey everyone, just a quick addition to what Richmonders can do now while we are in green status to prepare and feel equipped for what might happen, but also still enjoy life and visit your neighbors now that we're in green. So just encourage everyone to keep masks, keep a box of masks, keep your hand sanitizer. So if you go visit grandma or someone who in your pocket, great. So someone's visiting someone who is immunocompromised or is feeling ill, you can use that. Keep those at-home test kits. So keep a couple next to you for when you might have, flu-like symptoms, but also before you may visit those friends and family who may be immunocompromised. And then third, stay up to date. We'll continue to communicate. We are here. We will provide vaccinations. We'll provide testing. We'll provide that up-to-date information to walk you through whatever may happen in the future. Thanks.
I gotta say, Amy, check on my behalf. I've got my mask. I go everywhere with it still. I've got my at-home tests, and I stay up to date because of the good work that you all do. Thank you, everyone.